My special population for this topic is the Hmong population. I chose this population because it is a very isolated and interesting population that has very specific cultural practices. If these cultural practices are not respected and followed in a healthcare setting, this could drastically affect the patient's hospital experience as well as their healing. The Hmong people originate from southern Asia in Laos and Vietnam. Many began to immigrate to the United States in the 1970s as refugees after the Vietnam War. They have mainly grouped in California, Minnesota, and Wisconsin. Communication in healthcare is always a priority between the patient and the provider. It is very important between the provider and a Hmong patient because it is very likely that they speak the indigenous Hmong language and are not proficient in English. This means that their Hmong patients will pay very close attention to nonverbal cues. It is important that the healthcare provider is aware that they have to be very selective of the words they use to avoid insult, because if a Hmong patient feels disrespected, they will save face, which means they will protect their reputation and the comfort of the person they are talking to by avoiding confrontation. And then they will leave the health institution and not return, but most likely continue with home remedies. A potential solution for this is to present them with infographics that focus very much on the graphics so they can feel comfortable with understanding the photos and following along without being uncomfortable with their limited English skills. It would also be helpful to have materials that are written in their native language that they can understand and read to make them feel more welcomed into their environment in the health institution. Another option would be to have a translator on staff, or potentially a family member who can translate the symptoms and the treatment between the healthcare provider and the patient. The Hmong live in a patriarchal culture, so the woman will often converse with the healthcare providers, but it is the male who is the head of the house, and he will be making the decisions related to healthcare. Also, the elders are highly respected, and they will be considered when making key decisions when dealing with illness. Religious leaders known as shamans are used for spiritual healing. The Hmong view illness from a very holistic perspective and consider spiritual healing as equally important as physical healing. If someone is ill, it is likely due to the state of their soul. It is potential that they lost their soul, the spirits and ancestors are unhappy with the person, or someone placed a curse on the family. If any of these are the case, the shaman will perform a spiritual healing ritual either in the hospital or at home. And this is to retrieve the lost soul of the person that is currently resting in another realm. A certain Western medicine practice the Hmong tend to not partake in is surgery, because the opening of the body allows the soul to escape. This is a potential cause for many strains in the treatment of someone of the Hmong culture in Western medicine. The Hmong tend to not understand preventative care, but focus on visible illness or illness that is visibly causing an ailment and that they can treat acutely. They also do not believe in immunizations because they do not see or understand the importance of them. But a solution to this is to thoroughly explain their importance. And shown in this photo is an organization reaching out to the Hmong in Fresno to get cancer screenings. And though they do not normally practice routine health, programs like this will help the Hmong to understand the significance of preventative care for their longevity. The Hmong tend to not have a trust for government or healthcare professionals because they do not understand their intentions. And so when they are given a pharmaceutical drug to take, they are not motivated to take it because they are concerned about how that will affect their spiritual lives, but they are also considering they do not also understand the need for a pharmaceutical drug to treat something that they cannot visibly see. A solution to this is to make your intentions known as a healthcare provider and potentially find a peer who has also experienced this illness, so the Hmong patient will not be fearful of the person in authority. An interesting nonverbal mannerism difference between American and Hmong cultures is nodding. In American culture, it means, yes, I agree. In Hmong culture, it means that they are listening, but not necessarily that they understand or agree. So they may do this in a healthcare setting because they are saying they are listening to the healthcare provider, but they may not actually understand. So a good way to avoid confusion is to ask the Hmong patient to repeat the diagnosis or treatment back to the healthcare provider to make sure that they are understanding. According to If the World Were 100 People, 70% of the world would speak 6,500 different languages. If the world was only made of 100 people, there would be very minimal conversation, but this conversation may look like the one between a healthcare professional and a Hmong patient. In both hypothetical situations, it is very important to find common ground of communication if language is not creating a bridge itself. My discussion questions for you are: what would be a good way to explain the importance of preventative care to someone in a Hmong culture? My second is, how could a healthcare professional convince a Hmong family that their son needs surgery while still respecting their thought that surgery allows the soul to escape? Thank you very much.